Doctors of Reddit, what's the most outrageous self-diagnosis that you've heard from a patient? My mom took my sister and me to the doctor when we were kids because we had weird bumps all over the back of our tongues. We were diagnosed with tastibodes. Edited for my grandma homies. I work in physical therapy. And once had a guy with dementia say, "I know I'm in pain. But I just can't remember where." I felt bad for laughing about it later, but I had never heard something like that. ER doctor here. I had a patient insist she had a fever once, and when I pointed out that our thermometer did not record a fever, she told me, "I'm not sure they taught you this in medical school, but when Asians get a fever their temperature doesn't go up." Yup. I missed that lecture. Had a patient come in once due to weight gain that she thought was due to being pregnant. Made sense. Except she'd taken more than half a dozen pregnancy tests and they were all negative. She was convinced she was pregnant though. And wanted me to check. I tell her okay. I'll do a blood test. Since we can detect pregnancy earlier with that. And she refuses. Says that she just wants to pee on the stick in front of me and have me read it. So I say sure. And lo and behold, it's negative. Little more questioning. And it turns out she'd been eating literally nothing but chicken wings for weeks. When I asked her why in the world she would do that, she replied that she just really liked chicken wings. Paramedic here. Technically not a doctor, but here goes. Walked in the door to a young male with chest pain. As I walked up to him and introduced myself, he said, "I have pericarditis." I felt like telling him. Double quote. "I'm not sure how you would know if you did. But we'll run some tests and see what we have." Put an ECG on. Took him to the hospital for more tests. We found out the final diagnosis by the hospital staff was, surprise surprise, pericarditis. So there you have it. The patient was right. I still have absolutely no idea how this kid knew that. Kinda opposites to what everyone is saying. But once saw a guy with a foot that looked like death, probably untreated diabetic. He only went to the ER because his sons dragged him. He literally had his foot inside a plastic bag. Bag was tied around his ankle because of the smell. He insisted he was fine and to be let go. The amount of horribly sick patients that think they are just fine is too damn high. I had a patient a few weeks ago who was in her late 80s come in worried about having a sexually transmitted disease. She goes on to tell me that she hasn't had sex since her husband died in 1994. I am an allergist. Vet student here. I've had some dude with a super aggressive dog diagnose the poor thing with neural instability, causing his aggression, from an online consultation with a homeopathic shaman. He then came into the clinic with instructions from the shaman that he wanted the vet to carry out, including rubbing the dog all over with a $200 healing stone, despite the fact that the vet had obviously the more reasonable explanation. He didn't want to believe leaving a dog in the backyard without much human-animal interaction for most of its life could cause aggression. Go figure. ER and family practice mid-level here. Had someone come in one day saying they had wires and fibers under their skin, including a little Ziploc bag of, you guessed it, wires and fibers that they had pulled out. He said with a needle. Now, this is more Gelance, a well-known psychological entity. But to see it so blatantly like you read about in the textbooks just blew me away. He actually believed it. Very unsettling. Dentist here. 27-year-old patient comes in with mother. Mother is on disability. Patient has large amounts of decay on every single tooth in his mouth. Kid absolutely will not even listen to having his teeth pulled and dentures placed. Public health office, so most are uninsured, low financial status. Really should have most if not all of them pulled. Agreed to do a mock-up treatment plan which came out to roughly $4,500. That's with the sliding fee discount of 50% for the lowest financial level. They agree to pay. Mom plunks $800 cash down for root canal to start off. I ask what happened for his teeth to get that bad. Stupidest answer I've had yet. Double quote. A dentist before told me to mix dollar store mouthwash with peroxide and rinse with it. It absolutely wrecked my teeth afterwards. Mother agrees and swears that same thing happened to her husband. Older brother is getting all of his pulled. Dentist here. I had a patient come into my office. Absolutely certain he only had gingivitis and needed a normal cleaning. All because he had googled his symptoms and believed he could get a normal clean and go back home and do oil pulling after. Which would somehow miraculously heal his gums. Would not allow me to take X-rays or deep clean his teeth. Which he needed because plaque was formed well below his gums. He even told me his gums were bleeding from just smiling, moving his mouth, etc. He insisted on just a regular clean and then accused me of trying to make money off him when I basically put my foot down and said I wouldn't be working on his mouth unless he allowed me to do my job properly. I was glad when he decided to walk out and never come back. Posted earlier things my patient as a paramedic told me. But this one is mine. Albeit in reverse. Finally went to urgent care one night after several days of severe abdominal pain. Doctor insisted that it was appendicitis. Despite my insistence that I do not, in fact, have an appendix. He was thoroughly confused when he couldn't find the appendix with the ultrasound. Q looking for my gallbladder. Thinking gallstones. Swing and a miss. I'm missing my appendix because they took it out along with my gallbladder at 5YO due to gallstones. I had a woman once that was convinced that someone was trying to steal her Klonopin. So she ate all 45 of them. We tried to get her to drink AC so that we hopefully don't have to lavage them out. She fought us over that because now we were the ones who were trying to steal them from her. That was on an ER rotation in paramedic school. Another was the woman who swore she was having a heart attack, despite not having any symptoms at all. We did the EKG and full workup, which unsurprisingly came out completely normal. She insisted, so we transported her anyways. ER apparently ran all their tests and discharged her when they were clear. 3 hours later, guess who calls? She's still convinced she's having an MI and wants to be transported to another hospital. She was politely told to frick off. Found out later that she calls once a week or so. Unrelated but funny was the old man who called us out because he couldn't find the TV remote. And his son was asleep. Guy comes into my old ER one day with a nail in his hand from an accidental discharge of a nail gun. Nurse is checking him in and asked him to rate his pain on a scale of 1-10. He replies that it's only about a 3. We all look at him like he's nuts because our pain is at a 5 and we're just looking at him bleeding. Plus, this is a charity hospital where 99% of the patients are sitting in bed, casually texting or chatting on the phone, but still rate their pains as 10/10. You get the picture. So, the trig nurse rolls her eyes and asks him how it could only be a 3. He responds by saying that one morning he was cooking his girlfriend breakfast. They were especially hungry that day because they had just been a bit frisky when they woke up. Since they had just finished, he wasn't wearing any pants. Well, he says that when he bumped the pan in the hot bacon grease spilled onto his testicles. That was certainly a 10/10. So, to him, a nail in the hand only rated a 3/10. Patient told me she knew it wasn't a heart attack this time. It felt different than the last 19 times she came to the ER, which weren't heart attacks. She was half right. It wasn't the same as the other times. She died. Heart attack. Refused transport to a cardiac center. Someone had booked an emergency appointment to have a mole inspected because it had shown up overnight and was cancer. About 5 seconds into the exam, I wiped the mole off using my finger. It was chocolate melted onto her skin. My elderly friend is the queen of self-diagnosis. She tells the doctors her prognosis and rarely follows through with their treatment for her actual issues. My personal favorite is that she produces too much electricity. Because of this she has issues with anything electrical. Namely computers, cash registers, pin pads, and my personal favorite, gas pumps. She is afraid she will blow up the pump, so I fill her tank for her. In reality she is confused by technology and never wears her glasses. She was recently put on vitamin D pills because she rarely goes outside. Her house is basically a black box inside. I'm afraid to find her wrapped in foil one day. My sister keeps diagnosing me with endometriosis and polycystic ovaries and another one I can't remember. She gets furious with me for not going to the doctor because I don't care about my health. And I'm sticking my head in the sand etc etc. My only symptom is irregular periods and normal cramps, fatigue while on my period. But apparently cramps aren't normal and neither is wanting to eat chocolate and take a nap. It's gotten to the point where I literally cannot say a single word about my health in any way, shape or form without her jumping on my ass. And no, she's not a doctor. She does have endo and cos, which apparently qualifies her to diagnose me. At the psych hospital, we had a difficult patient, violent, making wild accusations, completely psychotic. During treatment team meeting at the psych hospital, when we were working out her treatment plan, she suddenly started screaming that she'd gone blind, that she couldn't see, and if we cared anything about her we'd help her. This time, she had a point, though. The lens of her eyeglasses had fallen out and landed in the breast pocket of her shirt. As a resident, I had one patient wait in the ER waiting room for 8 hours for painful lips. Diagnosis: chapped lips. Prescribed chapstick. Another patient waited the same amount of time in the ED waiting room at the county hellhole hospital. The reason? Mosquito bite. One stupid mosquito bite. He said he was a hemophiliac and was afraid he would bleed to death. Edited typo. Self-diagnosis? Maybe not, but a woman once asked me if I could find the rock of crack that she shoved in her vagina the day before when she was pulled over by the police. She wanted it back, if possible. People blaming vaccines for all sorts of illnesses, ranging from congenital mental handicaps, children's behavioral problems to cancer, autoimmune diseases, senile dementia and so on. Most of the comments here are funny or eccentric anecdotes that happen once in a while. But there are shitloads of patients that every day claim that their grandpa died of heart attack at the callow age of 96. Because of the effing flu shot that the family doctor prescribed. He was fine before getting it. Yeah. Smartass. Those flu shots most likely allowed your old man to even get to die of heart attack at 96 instead of flu-induced pneumonia at, like, 75. I was coming off an all-night LSD experience and managed to convince myself, on next to no evidence, that I had anal cancer. I wound up calling my mother in a panic. It was 7 AM and I was 25. And my girlfriend was there too. They talked me down. But I wasn't satisfied until I'd had a colonoscopy and minor surgery. Turned out all I had was constipation, hemorrhoids, the lipoma in my thigh, O grave A circumflex A diuresis, obligatory gold. Not a doctor, was the patient. A few years ago, during the summer, I started to get really sick. Fever, itchy sore throat, cough with mucus. Went in urgent care after my throat began to swell. The doctors tested for strep. Test was negative. They insisted it was mono. Tested for mono. Test was negative. Yet they kept insisting it was mono. Doctors gave me steroids and sent me home. Over the next 2 weeks the symptoms became worse. At this point, the pain of swelling was so bad. All I did was sleep and drink water chicken broth. Barely. My throat was so swollen I couldn't swallow anything solid. One morning I get up and my throat is completely swollen to the point I can't even swallow my own saliva. I have a panic attack and call urgent care. They tell me I'm coming right away. I go back and the doctor doesn't even look at my throat. Insists it's mono. So, my BF, X, freaks out and demands she look. She does finally and gets really nervous. Tells me to go to the ER immediately and they would be waiting for my arrival. Turns out my tonsils are abscess, about to burst. And I have tonsillitis. Worst shit ever. I once had a girl who said she had syphilis because she got like this ulcers in her mouth, which were coming and going, and she said she had zits on the back of her tongue. I looked and it was her taste buds. No other lesions to be seen. I told her that primary lesions in syphilis almost always cure completely, so if those ulcers were appearing and disappearing every once in a while it was very unlikely. By that point she had gotten a lot more relaxed and the consult went great and she went home feeling a lot better. Still, I made her get an STD panel because she was sexually active, young and in doubt of her partner. Next consult she shows up saying, "Doc, I think I do have syphilis." She did. I learned a valuable lesson that day. Cool thing was she wanted to do her treatment and follow up with me because she told me she had seen a lot of people before me but no one bothered to check. My best friend had weird symptoms for a while and became obsessed with googling and researching the possible causes. She was convinced that she had multiple sclerosis. She woke up one morning and the lower half of her right side was numb. She went to an emergency care and asked for an MRI. The doctor there believed she had sciatica pain and refused. Weeks went by and she went to another urgent care and was finally referred for an MRI. Turns out she had very advanced MS. Now is partially paralyzed.